you didn't need to swallow fluoride to make it work to prevent dental decay. I was concerned that people were accumulating fluoride in bone, in kids and elderly patients. At the time that all of these epidemiological studies were being published, where there's an increased risk for hip fractures. Danielson studies, Jacobs studies. These were studies that were starting to raise some concern in the medical community that perhaps fluoride could be causing some harm, some increased risk for bone fracture. So we set out to actually prove that 1 part per million wasn't really that detrimental, that it wasn't effective what these studies were suggesting. And that's how we actually got funded. We set out to prove that it was safe. Whether or not that's why we got funded, I mean, that's irrelevant. But the way we designed the experiment was simply to collect hip bones from people that were donating their hips during total hip implant surgery, compare the bone samples that we retrieved from people in Montreal, where Montreal is not fluoridated, never has been fluoridated. Compare that to the Torontonians, Mount Sinai Hospital. We now have compared about 60 samples. It turns out that the Montreal bone samples have a very small variation in terms of their fluoride content and hover around 200 parts per million. The variation in the Torontonian hip samples is tremendous. It varies from 200 up to 2,500 parts per million. We're now looking at just looking at one disease entity, osteoarthritis, factoring in all of the age effects, etc., and not even looking at Toronto versus Montreal, just simply looking at the fluoride content. Now we have done that. What we have done now is to look at the fluoride content in the same type of bone, and we've discovered actually, or Debbie, who is the PhD student, Debbie Chashra, has discovered that there's a direct correlation between the fluoride content and the architecture of the bone. In other words, fluoride just from water fluoridation exposure, because we presume that the Montrealers and Torontonians have had the same amount of toothpaste exposure. Because in Canada, fluoridated toothpaste was introduced in the same time. We now believe that the little bit of fluoride that's been incorporated into their bone has affected their. Now, whether that's positive or negative, we haven't got enough data yet to show. And the abstracts that we've published so far at the international meetings basically report these findings, that there are differences between Toronto and Montreal, that we are seeing effect of fluoridated water on the architecture of the bone. Whether or not this makes the bone slightly stronger or slightly weaker, we don't know yet. We do know from animal studies that the strength of the bone actually starts to decline the more fluoride you have in the bone. The fluoride makes the bone more brittle because the crystals are packed tighter, and these crystals actually make the bone like a crystal, like a more easily fractured crystal, and therefore a bone that's rich in fluorapatite or fluoride will break more easily. It's more brittle.
And that would appear to be consistent with these 8 studies on hip fracture.
Yeah. Well, the increase in fluoride that these people in the States have been exposed to from just water fluoridation may have contributed to the brittleness of their bone. Because the longer you live, obviously, the more fluoride you accumulate into your bone. And if you build up enough fluoride in your bone from the fluoride in the water, you may end up with bone that's slightly more brittle than average. And of course, we're concerned about hip fractures because that's a huge cost to the healthcare system. Studies show that it's devastating to these people, especially the old ladies, mostly women that are affected by this, end up in wheelchairs, and some don't live through the ordeal. They end up in nursing homes. There's been a study now saying that women would rather die than have a hip fracture because of the prospect of being in a nursing home in a wheelchair afterwards. So this is a huge issue that we're looking very carefully at what we're doing to our bodies, everybody's body. So far, Torontonians have only been exposed for 30 or 35 years to fluoridated water. What's going to happen in 60 years? We're seeing patients with 2,500 parts per million fluoride in their bone. You don't see that in Montreal. So what's going to happen 30 years from now when people are 70 years old with 60 years of fluoridated water exposure? If we continue to expose our population to the level of fluoride that they're exposed to now, there's no question in my mind that we're going to see bone problems, severe bone problems, further down the road, 30 years from now. No question about it.
What about this notion of things around the bone? I guess arthritis, the joints. What is this concern? Could fluoride be interfering with the materials around the bone?
It's well known in the endemic fluorosis areas that the first sign of skeletal fluorosis is aching joints. Fluoride deposits actually in the joints, in the soft parts of the joints, the tendons and the cartilage. And that fluoride deposition results in real achy joints. Nobody, to my knowledge, has yet looked carefully at fluoridated cities or fluoridated populations and looked at the symptoms of arthritis to determine whether or not fluoride is contributing to this endemic or possibly epidemic of arthritis that we have in North America.
Could you give us any other concerns that you have? We talked about teeth and we talked about bones. What about beyond bones?
I'm quite concerned because I'm now learning the chemistry behind fluoride mechanisms and its toxicology. And it's quite possible that fluoride, even at low levels, could affect essential mechanisms such as the cyclic AMP second messenger. Fluoride is a known activator of G protein. And we figure, or some people figure, that fluoride could be affecting all kinds of cellular metabolism through this G protein mechanism. I'm concerned about the effect of fluoride on thyroid tissue. I'm concerned about the effect of fluoride on a number of other tissues. We've learned now that it accumulates in the pineal gland, that it may be affecting melatonin production. I'm concerned about reproductive organs and its effect on reproductive organs. There's lots of animal studies to show that at higher doses it's devastating to the animals' reproductive systems. So, there are some studies that are coming out now looking at human beings in fluoridated cities where there's been 30, 40, 50 years of water fluoridation. We should be doing studies. We should be carefully looking at the effects of fluoride level exposures and the soft tissue effects.
How's the dental community responded to this latest research and the things that you've mentioned, the pineal gland and the G proteins and the other studies that you mentioned? I
can tell you that literature that they would have read about the toxicology of fluoride. The journal Fluoride is not even in our dental library. I've now made sure, thanks to the generosity of the International Society for Fluoride Research, they're going to send us the journal back issues to put in our library. The dental community has no idea of the toxicology behind fluoride. The environmental issues is news to them. We really have to do our job to educate the dental community on the possible harmful effects of fluoride.
But we often get either dentists or representatives of the American Dental Association going in front of the public saying there is no debate, there is no scientific debate, there is no evidence of any harmful effects. Where are these statements?
It's based